Peace FM 104.3. Good to meet
the numbers of COVID cases, Grandpapa, we don't really know the numbers because we are not testing all that much. In the earlier stages, what the team did, was fantastic. But to baby, Grandpapa, there was a breakdown in the process. There's a fundamental breakdown. Doctors were yare yama to the point today.
There are doctors who are GMA members on the national COVID-19 team.
Yeah, but GMA itself.
Remember,
sorry.
No union group has been given permanent slots on the COVID-19 team. But the input of these unions were sought from time to time in the form of consultations. Government has now given slots to 5 health worker unions on COVID-19 management teams at the district, regional, and national committees. This is to get them right in the fight and to help update their members at all times. The vice president will be meeting these groups fortnightly, like he did last week. All energies on deck from the center, not from the flank. These 5 groups are Ghana Medical Association, Ghana Registered Nurses and Midwives Association, Government Hospital Pharmacists Association, Health Services Workers Union, and Ghana Medical Laboratory Scientists Association. Sent to me by my Member of Parliament for Lejokuku and Deputy Minister for Health, Bernard Oko Boy, MP. So that answers.
Yes, Grandpa there say, "Hey, cries into some now mechanical." Oh, yeah, right on point. Better late than never.
Yeah.
At least wait or improve the process, because I mean I heard it from the General Secretary. And say why take General Secretary Nisu. Let's say why incorporating into the process. I'm not going to
listen to government.
Well, I'll be a Kebiaka. I won't respond. You are tempting me.
Watch
No, it's attempting me to reply him, and I won't do it. I said me stay above board. I won't do it.
That's not what.
It take the first place. I can't consider.
Let me read this one also quickly. The cacophony of allegations in which the NDC is engaged is to cover their own shame. They swore heaven and earth that the registration exercise wasn't going to take off. Now they are the ones seeking to engage in the exercise more than everyone. Must we impugn politics in everything, including COVID-19? The key challenge with the social and economic aspects of the response to COVID in Ghana is the lack of debate about the enormous investments that will impact Ghana's economy for the next decade. Indeed, the crisis has provided a window of opportunity to deeply change Ghana's economy, and that's why tough decisions are being made for the benefit of all. Do we know a specific date on which COVID-19 will end? The earlier we learn to live with it, the better it is for all of us. Amazing convictions. Mancha Bruce the second in Tadi sends that one. Anyway, Party Chairman Patricia.
Yes, Grandpa, my firstborn was a medical doctor.
Oh, great.
Practicing doctor. And it's American, and you may be a member insight. Look, Grandpapa, at the rate that the health professionals are getting COVID-19, it's not a joke. Grandpapa, emergency wards and things have been closed down because the doctors, the other work quarantine, and going on the quarantine, we need replacements. We have a serious matter at hand, Grandpapa, and people are scared. And PPEs, look, they are crying about, medical professionals are crying about PPEs. They are not getting it. I'm sitting here on authority, and I'm telling you, they are not getting it. And this is a very alarming situation, Grandpapa. And every time they hear frontline workers, Grandpapa, let's support them. Let's support them and get this thing done, because for Mother Ghana, Grandpapa. And we need to be able to focus. Sometimes testing is very expensive now. And Grandpapa, when people say that, my stomach boils, because how can we quantify lives and our processes?
Right.
And Grandpapa, my stomach boil, because we have to stop talking. And comfort air condition, when you are general, what can be Grandpapa, the people out there are not happy with such utterances. The other utterances are we must live with it. Grandpapa, that is also a very serious matter. Because as you must find ways to eradicate. Not that we live with it, accept is with us. Grandpapa, these talks and these statements or retarded the progress of the fight against COVID-19. Because or your attitude or your pitch poor attitude, pitch poor. There, intimate, just cheeky answers. Cheeky answers in a crisis that you need to put all of us behind you to fight. Then they tell me about protocols. Am I going to go against the protocol? Grandpa, I had to get my whole family tested last 2 weeks because a friend of mine had it. A very good friend of mine. And to quarantine the whole house. Now what the swab I say what the results we were all clear. The doctor told me that this is one of the rare cases where testing of a family of the sampling size of 8. Nobody had it. No BNB. Now where she's going, the results that are coming out is not a joke. And when they came into the house, they were what dressing, the precautions that they were taking. Grandpapa, she told me, and in fact, imagine Diagre. It is a very serious matter which is happening in our nation, and then we all need to rally behind the processes and don't politicize it. Only I support that we can't politicize, but you can't also give us statements that seem to think that you are doing everything and anything, and that you should not be criticized, and the processes are not going well. You can't about General Secretary what they spot actually. Because how do you omit Ghana Medical Association from the process? COVID-19. They said, well, clearly they don't know anything about what you are saying. Nyama was alien to them because they are not part of the process. No, be a doctor, nurse, or honeyman. Does that person report to the Ghana Medical Association? That one cannot be an answer. That one cannot be an answer. So I'm glad that we'll take retractive processes and statements what they fix this process. Grandpapa, the health sector is under siege. They are under siege. The cases that are coming to them are overwhelming. They are not able to maintain it because Grandpapa, the strategy is not yet fair, and the conflicting statements here and there of what we should do, and how people are jumping into people and just spraying this thing on people as if they don't care. So if leaders don't care, how would the population or the populace care? How would they care? And now the police officers are scared to death. There will be original liar on your protected that they should arrest. Well, arrest not nakwahin. Only protective arrest in the narco police cell. No, I could spray what police cells one because the police cells too are not equipped. There was with a face mask. Obi bet you won't be our own face mask. And think where is the solution? Where is the solution? Leadership must come out with a concrete solution and take this thing. And people are what flaunt. Look, Grandpapa, when you drive through the evening and you see Krofo from here, what says I did what crime chain or be anyone or face mask. Oh my Benyimbi another Besiabi Shakona. Now from wait Jabaya 12 of them. None of them are wearing face masks, and they are interacting with hawkers here. What's what on Azi? Bebre dominant and face mask will be so on into into on set.
Entina CCR police for Wabegum.
That's all. Yes. But the police coming in Jom, Grandpapa, have you equipped them?
With what?
That with PPEs.
Have you seen them?
No. For the person that is being arrested. I'm not talking about the police having it all. Nipakona H na only PPE, How are you managing that process to take the person to wherever you're taking the person? Are you not also going to create an incubator of disease in that corner that you are taking the person? So I'm not talking about the presence of the police, Grandpapa. I am talking about that you better equip the police people with the right tools to be able to deal with the menace. Because they have given police extra PPEs for people that they arrest. Immediately so that you transport the person from that place to wherever you're taking that person. Grandpapa, there is a flaw. There's a weakness in the process.
Okay.
There's a weakness in the process. We know that the police people have been giving the PPE.
So police people what got to arm robbers are. Remember when she won't be going to PPE.
Grandpapa, you can't arm robbers. Yeah, violate the law.
Let's wait and see how the operations pan out. Then we'll.
This FM 104.3. Good to meet you.